Headache in pregnant women. When to worry? Headaches during pregnancy are quite common. But it is not always easy to distinguish between a recurring, pre-existing migraine condition and a headache caused by a pregnancy complication. Physicians should pay close attention when a pregnant woman presents with a severe headache, especially if she has elevated blood pressure or lack of past headache history. She could be at risk for pregnancy complications, including preeclampsia, which put both the mother and fetus at risk. Those patients should be referred immediately for neuroimaging and monitoring for preeclampsia. The first clinical study, Acute Headache Diagnosis in Pregnant Women, a hospital-based study for making diagnostic decisions about headaches in pregnant women, comes from Montefiore Health System and Albert Einstein College of Medicine of Yeshiva University. This is the largest of its kind and is published in the journal Neurology on August 2015 by Matthew S. Robbins, M.D., Director of Inpatient Services at Montefiore Headache Center and Chief of Neurology at Jack D. Weiler Hospital of Montefiore, and Associate Professor of Clinical Neurology at Einstein. Preeclampsia typically occurs during the second or third trimester of pregnancy and may be related to an abnormal interaction of blood vessels that supply the placenta. Symptoms and signs can include high blood pressure, headaches, blurry vision, or abdominal pain, although some patients may have no symptoms. Depending on the severity and the age of the fetus, treatment ranges from bed rest for mild preeclampsia to premature delivery if the condition is severe. Dr. Robbins and colleagues analyzed records of every pregnant woman with headache who had been referred for a neurological consultation at Weiler Hospital over a 5-year period. The researchers found 90% of the primary headache were migraines. Among the secondary headache, 51% were diagnosed with pregnancy-related high blood pressure, including the 38% of women who had preeclampsia. The most important indicator of a secondary headache among pregnant women is high blood pressure. Women with headache plus high blood pressure faced a 17-fold increased likelihood that their headaches were caused by some other condition. In most of these patients, their elevated blood pressure was driven by preeclampsia. The researchers found that another red flag for a headache that should be taken seriously was lack of a previous history of headache, which was associated with a 5-fold increased likelihood that the headache was secondary to something else. Other warning signs were fever, seizures, and headaches in the absence of phonophobia and psychiatric problems.